Hello everyone, welcome to this panel discussion. My name's Vaughan-Jones and today we're talking about cancer, specifically ovarian cancer, and the impact of the COVID-19 pandemic on diagnosis and care. Before we get into the meat of the discussion, here's a bit of context for you. Evidence shows that urgent referrals and testing rates across the world have reduced by as much as 80% since the start of the pandemic, and cancer diagnoses have dropped by nearly 50%. And as I said just now, the discussion that we'll have today will focus on ovarian cancer, and that remains a major health concern and is the 7th most common cancer in women across the world. So we're going to hear from those who have received an ovarian cancer diagnosis and those who've supported patients. We're really hoping to get a real insight into the impact of COVID-19 on both sides of the healthcare systems. Although, of course, we should also state at the beginning that COVID-19 has, of course, impacted different regions and systems globally in different ways. And so this is not expected to be representative of all the systems out there. It's a snapshot, though, of a very difficult state of medicine and healthcare at the moment. So let me introduce the panelists that you can see on screen now. So Tracie Miles is a specialist nurse in gynecology. Irmina is a cancer patient and a nurse as well. Clara MacKay is the CEO of the World Ovarian Cancer Coalition, and Dave Fredrickson is Executive Vice President of Oncology at AstraZeneca. And I should also say that our thanks go to AstraZeneca for giving us this platform for a discussion today. Now, perhaps we can kick things off then by asking all of you to briefly introduce yourselves and perhaps talk a little bit about your relationship to this subject of ovarian cancer. And Tracy, I wonder if we can come to you first.
Hello there, Hannah. Yes, hello everybody. So my name's Tracy. I'm a gynae cancer nurse specialist and have been actually for the last 20 years. It's been an amazing career looking after women with all gynecological cancers. Obviously, we're talking about ovarian cancer today. And in the last decade, I've become very interested in genetics and the genetics of ovarian cancer in specific. So I'm also what's known as genomics nurse practitioner. My third hat is working with the third sector, the charity sector. And I work with the wonderful Eve Appeal, and I listen to women's voices every day and their concerns around ovarian cancer and COVID. Boy, yeah, you've nailed it. It's been a nightmare.
Yeah, okay, well, we'll hear lots more from you, Tracy. Thank you. Irmina, over to you then, your relationship to ovarian cancer, and thanks for being here.
Hello, everybody. I'm Irmina. My background is being a theatre nurse in private hospital, but last year, June, I was diagnosed with stage 3 ovarian cancer in the height of COVID pandemic. Therefore, I would like to share my story with other people.
Well, thank you in advance for doing that and for being with us to share that story today. Clara MacKay, let's come over to you then, Clara.
Hi, I'm Clara MacKay. I'm CEO of the World Ovarian Cancer Coalition. The coalition is a global network of just under 200 patient advocacy organizations worldwide. We have members in about probably 40 countries, a very diverse membership from volunteer-led organizations right through to more substantial organizations working in high-income countries. I would just echo the comments. COVID-19 has just been such a challenge for everyone, but I think there are some specific cancers like ovarian where it has been especially challenging.
Okay, very interesting. And last but by no means least, our only man on the panel, Dave Fredrickson. Dave, over to you.
Hi, Hannah. Thank you so much. It's a pleasure to be here and to share the stage with all 4 of you women. My involvement here is relatively straightforward and simple, which is that I've had the opportunity to work in the ovarian cancer space now for the better part of 2 decades. And so within that process, I've had an opportunity to really much more deeply understand the diagnosis, what survivorship looks like, and how we can make sure that we're supporting those that are either fighting or caring for those who are fighting this terrible disease.